Now let's discuss cold-related emergencies. These include frostbite and hypothermia. Frostbite is the body tissue which is actually frozen. Most commonly, frostbite occurs after a long time of exposure to cold on the extremities, most commonly the toes and the fingers. The affected area will usually swell and become numb. It can appear waxy and cold to the touch. Frostbite becomes severe when blisters form or the affected area turns black. For severe frostbite, call 911 or seek medical care as soon as possible. Now, if you see signs of frostbite, remove the person from the cold and handle the area as gently as possible. Do not rub the area as this can damage the tissue. Also, try not to break blisters as this could lead to fluid loss and even lead to infection. Don't try to rewarm the frostbitten area if there's any chance of refreezing. If it's necessary to rewarm the area, soak it in warm water, but less than 105 degrees Fahrenheit. You can soak it for 20 to 30 minutes. The water shouldn't be too warm or it can cause further complications and unmanaged severe pain. After the hands or feet have been rewarmed, keep the fingers and the toes separated by placing gauze or cloth between them and loosely wrap the area with a dry gauze. Be sure to seek advanced medical care as soon as possible. A life-threatening cold-related emergency is called hypothermia. This not only happens outdoors, it can happen indoors as well. The very young and the very old can be more susceptible in a home that is poorly heated or air-conditioned. Normally, the average body temperature is 98.6 degrees Fahrenheit or 37 degrees Celsius. Hypothermia is defined as the core body temperature dropping below 95 degrees Fahrenheit or 35 degrees Celsius. In the early stage of hypothermia, the body normally gives warning signs like dizziness or fatigue, slight confusion, and shivering. Shivering is your body's attempt to rewarm itself. These signs are telling you that your body is getting cold and it's helping it get warm. Unfortunately, someone going into hypothermia usually isn't aware of his or her condition because the symptoms often begin gradually, and then they get worse as the person stays in the cold environment. As hypothermia becomes severe, the shivering eventually stops and the following signs begin to appear. Numbness, maybe some slurred speech, a glassy stare or confusion, weakness, clumsiness, or even a lack of coordination, slow, shallow breathing, and then eventually unresponsiveness. Now, if you see signs of severe hypothermia, call 911 or your local emergency medical services right away. Move the person to a warmer place, handle them gently, and rewarm them slowly as long as there's no risk of them refreezing if they have frostbite. Rough handling or rapid rewarming can cause cardiac arrest. Remove any wet clothes, cut them away if necessary, and then dry the person and cover them with layers of those nice, dry, warm blankets. Cover the person's head, leaving only their face exposed. If help will be delayed or you're far from medical care, try to get the person near a heat source or apply warming packs to the chest wall, neck, or their groin. If the person is conscious and can swallow, give them warm beverages that do not contain alcohol or caffeine. If you're outside on the ground, insulate the person from the cold ground. Standard first aid kits often include a first aid foil type blanket. This is a great multi-purpose piece of equipment that works very well to keep a person warm in a hypothermic emergency. This type of emergency blanket also provides a great waterproof barrier. This is especially helpful if a person is on the cold, wet ground and you're not able to move the person to a dry, warm area. To properly warm a patient with a blanket, lay the blanket out on the side of the person. Then roll the person towards you and tuck the blanket under them. Gently roll the person back onto the blanket. Pull the blanket up and then together. tuck the blanket in and around the body. Then, tuck the blanket around over the person's feet and around the head, keeping the face uncovered. If you have a regular blanket, lay that over the person too, and then tuck it into the sides to help maintain the patient's body temperature. We need to monitor the person carefully while waiting for emergency medical services to arrive. Start CPR if the person becomes unconscious and stops breathing normally.